Hello, I'm Elise Prezant, Coordinator of Services at Jewish Family Service of Somerset, Hunterdon and Warren counties. We are a nonprofit, non-sectarian social service organization. Our doors are open to the entire community, serving clients of all backgrounds, including race, religion, ethnicity, culture, socioeconomic background, gender, sexual orientation, age, and physical ability. In response to the pandemic, we applied for and received the Robert Wood Johnson Foundation grant to provide homebound and isolated older adults a unique device that would connect them to family, friends, and the outside world. To accomplish our goal of decreasing isolation felt by many homebound older adults, we partnered with the Jewish Family and Children's Service of Southern New Jersey, as well as our local offices on aging and the Community Visiting Nurse Service. Social isolation among the homebound elderly has always been a concern, and during the pandemic, the problem has become more acute. Family and friends are no longer able to visit in person. Most volunteer visiting programs have also suspended home visits during the pandemic, leaving isolated older adults even more alone and at risk for depression and decline in their overall functioning. While some of us have adapted to remote contact with friends and family via Zoom and other platforms, many older adults living on a fixed income find this type of technology difficult to use or can't afford the devices and monthly fees for internet service. To address this, we partnered with Uniper, a tech company in California, to install a device that attaches to the older adult's TV and is operated by a regular TV remote control, something most older adults are comfortable using. Once installed, the older adult can easily use their TV as a communication device to contact their family and friends for a video chat. It can be used to link to online programming on the Uniper channel for social, recreational, and health programs as well. So far, through this grant, we have distributed almost 20 devices, and while startup has been complicated by the need to do most of the basic training on the use of the device remotely to minimize social contact during the pandemic, we already have reports that some of our older adults are using the Uniper system to connect with family and are using the online social, recreational, and health content provided by the system. By the conclusion of the grant, we are hoping to have 30 older adults enrolled in the program, and through surveys and interviews, determine how helpful this approach was to increasing social isolation and depression in this sample group of our most vulnerable population living in the community. Where hopefully outcomes will point us in a better direction when addressing the social, emotional, and health needs of the homebound elderly in our community and improve support for aging in place.